The experience in the wake of the global pandemic are underscoring the severe inequities of the U.S. healthcare system. When looking at people's access to healthcare, we must look at social determinants, of which immigration status is hugely influential. In this month's Think Table, we delve deeper into looking into the ways in which immigration status affects healthcare access, beyond simply looking at documented versus undocumented. The problems of the U.S. healthcare system are now more important than ever in light of the pandemic and the upcoming election.
Coronavirus as a pandemic really kind of shone a light at the health inequities. And that's something as public health practitioners and researchers, we're very much, that's kind of our lens. In my approach of public health, I look at it from a social justice lens, right? And so where are the inequities in terms of accessibility of care, quality of care, of resources, whether it be economic resources, educational resources. And so I think that the pandemic really brought that to the forefront.
Specifically about immigrants, how does access to healthcare depend on immigration status? And that's both on the federal and the state level.
Yeah, I think that's a wonderful question, because when we look at the community of the immigrant population, so to speak, and so I did most of my doctoral work in the border region. What I did is really look at mixed status families and their experiences to healthcare. And so we as a country have not had a comprehensive immigration reform since the 80s, right? And so we created a situation in this country where in one household, in one family, we have a division, a fragmented family where some members of the household may be US citizens, some of them may be legal permanent residents, and others may be undocumented, and others may hold documented status, right? And so through that fragmentation, they're not only fragmented through their immigration, but their accessibility to healthcare. And as we know, when there is a disease like the coronavirus, it's indiscriminate of immigration status.
There are only a few immigration statuses that are eligible to find a healthcare plan, and many immigrants, even though they are documented, don't have access to healthcare. In many states, DACA recipients are not eligible to access a healthcare plan, and the situation is particularly difficult for mixed status families. It's estimated that close to 4 million children live in mixed status families that include both citizen and non-citizen members, making the children's healthcare access and eligibility for public benefits even more complex. How can this be resolved? I mean, is this a federal issue? Should this be resolved state by state?
I do, as a healthcare professional, I can tell you that I do believe that it will take a federal response to this. There are so many unintended consequences of not having comprehensive immigration reform, right, in years. From my experience, I think the local state government, even local municipality, also have a responsibility.
I mean, what are some things that we can do, people not in government or not researchers, just regular people who see this happening and want to do something? What are some actions that we can take to help ensure access or to help move that forward?
So I think that's a great question about what we can do on the individual level, right? And then as a collective group within our own respective communities, right? And I think that without a doubt is voting. I think that those of us that are privileged to have the power to vote, we have to exercise it. And come November, we do need to show up. And I think that's something that definitely requires action. The other thing I always challenge folks that are buying into this rhetoric, right? To really dig. I always think about like my public health. When I used to teach, I used to always say, embrace your inner 5-year-old, keep asking why. And then when you get to the root cause of it, then you start looking at the world differently, right? Because there's certain, there are political and institutional structures that are giving more folks advantages than other folks, and mostly follow on racial lines, as we know.
I think we would all agree that access to healthcare is a basic human right. Unfortunately, due to the patchwork of laws and regulations in this country, many Americans, including millions of immigrants who are eligible to apply for healthcare, don't have access to it. If you want to stay up to date about these social justice topics, as well as many others, follow us on social media, sign up to our newsletter, where each week we send out an engagement menu where you can make a difference in the life of immigrants. See you guys next month.